Hello everyone, welcome to Health Talk with Fifi with me, Ajwa Duma Ansa. Thank you for your support so far, for sharing, liking and commenting on our videos. Keep the likes and comments coming. We are here for you. Today we are talking about insomnia, a sleeping disorder. So this sleep disorder is whereby you're having a trouble falling asleep or staying asleep. So this condition can be short term, which we term it as acute, or it can be long term, which we also term it as chronic. It may also go and it may come and go. Insomnia can be grouped into two. We have primary insomnia and secondary insomnia. So for the primary insomnia, it just simply means that your sleep disorder is not linked or associated with any health conditions or problems. So for the secondary insomnia, it simply means that your sleep disorder is linked or associated with a health conditions like asthma, depression, arthritis, cancer, heartburn, pains, some medications, substance use like alcohol and tobacco. So you might also come across sleep onset insomnia. So for this type or a form of insomnia, it just simply means you have a trouble getting to sleep. That is sleep onset insomnia. So you have sleep maintenance insomnia. For this one, so it happens when you have a trouble staying asleep throughout the night or you wake up too early. You also have mixed insomnia. So for this mixed insomnia, you have trouble both falling asleep, staying asleep through the night. So it's two things. You have a problem falling asleep, even if you sleep, staying asleep throughout the night is a problem for you. That is mixed insomnia. You also have paradoxical insomnia. So when you have this type of insomnia, you underestimate the time you are asleep. It even feels like you sleep a lot less than you really do. These days, I don't sleep plenty cry. This form is what we term as paradoxical insomnia. Yes. Now, let's look at some causes of insomnia. What will cause you to have an insomnia? Number one is stress. Stress relating to any other life event like planning a wedding, any ceremony, job, loss of a loved one, divorce, moving or relocating, anything that makes you stress, that stresses you or that stress the body, causes insomnia. So stress is number one cause of insomnia. And things around you like noise, light, temperature. You also have, when you have changes to your sleep schedule, it also causes you to not being able to sleep or staying asleep during the night. Okay, so there are also work shifts that causes you not being able to sleep during the night or keep you asleep. So these are some of the primary causes of insomnia. Let's look at other secondary causes of insomnia. We all know, as I mentioned earlier on, that secondary causes or secondary insomnia is as a result of a health issue or a health problem. So for the secondary insomnia, you can have a mental issues like depression, anxiety, or any mental disorders making you not being able to sleep. So these are some of the secondary causes of insomnia. You also have medications for cold, allergies and depression, or you are on medication for high blood pressure and asthma. It can also cause you not being able to, it can also be a cause of secondary insomnia. We have pain or discomfort at night, caffeine, tobacco or alcohol use as well can also cause. We also have hyperthyroidism disorders and other endocrine disorders can also cause insomnia. We have other sleep disorders like sleep apnea or restless leg syndrome. They can also cause secondary insomnia. Pregnancy is part. Then we have menopause and premenstrual disorder. Let's look at some ways to manage insomnia or treatment of insomnia. So for insomnia, especially acute insomnia, it may not need a treatment. But if it is hard for you to do everyday activities as a result of being tired and not getting enough sleep at night, then your doctor may prescribe sleeping pills for you for a short time. It doesn't mean that you can just walk to over the counter sleeping pills and abuse it, they might have a side effect and they tend to work less well over time. So over time, they wouldn't even work if you'd be taking it and you have side effects of it. So you put a stop to that, or you shouldn't have that habit of just going to the pharmacy to grab a sleeping pills. But for chronic insomnia, as I said earlier on, it's as a result of a condition or a disease. So you will treat the disease which is keeping you awake. That is it. Or your doctor might suggest a behavioral therapy which will help you. But the chronic insomnia wouldn't be treated, or you wouldn't treat the chronic insomnia, but the disease relating to the insomnia is what we treat. Okay, so let's look at some sleep hygiene or some tips to beat insomnia. So go to sleep at the same time each night and get up at the same time each morning. Try not to take naps, plenty naps during the day, and it will help because they make you less sleepy. The naps you take make you less sleepy at night, which causes insomnia. Then don't use mobile phone or e-books before you sleep because their light make it harder for you to fall asleep. Also, avoid caffeine, tobacco, or any other substance you use. Avoid it later in the day. Then also you have to avoid alcohol. If you drink alcohol, avoid it later, and it could be middle of the day, but not later in the day, which will disturb your sleep. Okay. Get regular exercise at least 3 to 4 hours before bedtime. Do not eat heavy meal late in the day. A light snack before bedtime may help you sleep. Make your bedroom comfortable, dark, quiet, not too warm, not too cold. Also, we can use sleeping masks or earplugs if there are noise or light to disturb you. Make sure you keep your room less noisy. And if you tend to lie awake and worry about other things, make a to-do list before you sleep. This helps you put your concern aside for the night, then you can have a good sleep. Then you can also develop or follow a routine to relax before bed. You can read a book, listen to music, or take a bath. Then don't use your bed for any other thing than sleeping and sex. Thank you for watching today's episode. I hope you stick to us and you like this video. Keep your comments coming. Make sure you subscribe for more videos. Thank you.
Subscribe now.